We tried to take a focus on all the health and human service areas for sustaining the core, what I would call the most typical core functions of local government, health and human services, looking at public health, social services, the welfare of the residents, public safety, when we start to talk about public safety. And with DSS in particular, we made minimal recommendations for fairly minimal cuts to any service that residents would feel. There is some cuts in some vacant positions in DSS, limited service provision cuts, but with a focus of maintaining the core functions of case management and social work in that department. I think it's the focus that the manager wanted to put on what we would again call the core functions of local government, health and human services and public safety, and that maintaining those essential services in this community are going to be essential to us continuing to grow and thrive as a community. One thing that will probably get some attention is there is a recommendation to reduce some of the school health nurses. About 5 years ago, we started a very strong campaign to increase those resources in the schools. So you'll see a small ratcheting down of that we feel comfortable with going forward. Other than that, we've tried to maintain again the core services that we think are essential to residents. The areas that are cut are some of the education things around the Fit City focus that we had in the health department, and otherwise we're maintaining as whole as we can in public health. Again, an area with some minimal cuts. Some may think they're fairly significant. The recommendation is to cut about half of the funding for the Veteran Services Office, with really a stressed message to those folks in Community Support Services and the Veteran Services Division to work on collaborative partnerships, both internal to the county with other departments and external in the community, to maintain good service delivery for the residents in the community and for the benefit of the community. But it's not a complete reduction, and we feel like we can still maintain a fair service level in veteran services. A large number, it's a large dollar number in the cuts. The most significant would be the closing of the Work Release and Restitution Center. Serves about 90 folks right now. It would be a big shift for the courts to not have that resource. However, when you look at the things that are mandated versus not mandated in the public safety and detention area, there's just not a lot to get there. Well, that was our focus on service delivery, and if we were going to cut, it was going to be in vacant positions or in administrative services, but that we wanted to maintain the service delivery to the residents of Mecklenburg County.